Time now to talk about families and helping yours as they age. Carolyn Richardson from Pace Guide to Senior Housing and Jody Malamas from GAP are here with more. Thank you both so much for being here.
Thanks for having us.
Yeah, we appreciate it. Why don't we start with transitional care? What exactly is it?
So I think we talked in the past, Desiree, I called it the new buzzword in healthcare, and it's really that, like it says, transitions. It's helping people through those transitions between hospital and home, or hospital and skilled nursing facility, or maybe assisted living. You know, it's very fragmented, our healthcare system, so it gets confusing, especially for our seniors or families that are out of town. And a transitional care company actually comes in and handholds people through those different transitions.
Now, who or why would someone need transitional care?
Believe it or not, times of transition are where people with high medical complex needs are at most risk of failing or ending up back in a hospital. It's usually related to either medication errors or errors in communication. So a transitional team really helps build them up for a better outcome and helps reduce unnecessary hospitalizations.
Yeah, and we're seeing here why patients would need transitional care too, about conditions and care and needs. What does transitional care provide?
So it's typically a team of medical professionals, nurses, social workers, physicians who are knowledgeable of your medical care plan, knowledgeable of your circumstances and situation, and they are providing that information from one healthcare setting to another healthcare setting. They are providing education and advocacy and helping people be compliant with what their medical care plan is, and therefore, again, allowing them to be more successful in overall outcome.
Yeah, you say continuity, very important, and you deal with this every day.
Yeah, so continuity is probably the biggest key to success, that you're continuing to bring forward the communication, the clinical management, and the professional team that's been alongside with you throughout your medical event.
And not only that, it's good for the patient, but for the families too, because they can feel okay that their loved one is getting the care that they need as they transition through these things.
Yes,
All
yes.
right. Well, thank you so much. We appreciate you sharing that with us. And also, you know, a lot of people looking, of course, for a place to live themselves, for their loved ones. Today, we're focusing on the PACE sponsor, Fellowship Square Mesa. Tell me about that.
Right. So we're proud to spotlight Reflections at Fellowship Square Mesa, which offers an environment focused on relationship-centered care. The staff is trained by the National Council of Dementia Practitioners and by Comfort Matters. Caregivers are trained on medical, physical, social, spiritual, and emotional needs. By learning about each individual's life and anticipating their needs, the staff is able to provide comfort on the residents' terms. Special programs like 24/7 therapeutic programming and It's Never Too Late, they create an environment where residents can enjoy meaningful quality of life and live with dignity moment by moment. You can call for a tour at 480-422-3757, or you can call us at PACE and we can help guide them.
Yeah, exactly. PACE can kind of help you through all of these things we talked about today, and you can find out more about PACE by going online. Go to seniorhousing.org or call the number on your screen.